Hello, welcome to my YouTube channel. Thank you so much for your awesome support and enthusiasm towards listening all the latest topics. And I'm very thankful for your kind support. As you all know, I started this podcast to give you valuable information via my guests in the area of health, education, and lifestyle. It's a kind of social service initiative for all of you. And today we are lucky to have one eminent expert who can guide us in one of the most burning topic in terms of health. We are all having several issues like blood pressure, diabetes. So these are all well-known problems that we are all facing with. So as per the analysis, nowadays this GERD is another problem which is creating lot of discomfort for all the people across the globe. So if you have some kind of heartburn or else indigestion kind of problem, some kind of discomfort in terms of digestion, definitely you have to visit your doctor who is specialized in this area and you have to take their advices. So not wasting your valuable time, today we are lucky to have Dr. Pavan K. Addala, consultant surgical gastroenterologist who has done excellent work in his area and is a consultant surgical gastroenterologist practicing advanced laparoscopy, liver transplantation, and third space endoscopic surgery, and more things. We will listen to him, and I'm very proud to say he's first one to start third space endoscopic surgeries in the state of Andhra Pradesh in 2016. So let us not waste our valuable time. We will discuss with our guest. I request you all to listen to this useful discussion till the end. Do like, share, and comment in the comment box. So let us go and discuss with our eminent guest. So thank you, sir, for sparing your valuable time. I know you are very much busy, and it is great to have you. That you are from Andhra Pradesh, so we are all proud to have you uh, in this particular podcast session. So can you please kindly introduce yourself?
Thank you, Dr. Rajesh. I'm Dr. Pavan K. Addala. I'm Chief Consultant at Medicover Hospitals for Department of Surgical Gastroenterology and Organ Transplantation. I'm also heading general surgery there. And yeah, our main focus is into uh, liver transplantation and into GI oncology, that is GI cancer surgeries. However, being a surgical gastroenterologist, I do get all these benign problems, which are very, very common, particularly the GERD topic that you have taken. I think it's very, very important topic to discuss. As you said, it is very common and one of the burning problems in health sector. You won't be believing, Dr. Rajesh, the medicines that we use for acidity, they make the highest gross business across the world. So proton pump inhibitors, what we call like pantoprazole, rabeprazole, omeprazole, all these drugs, they make the highest business in the world. So that this problem is that common, and as you know, most of the patients know these names, so they get these drugs over the counter. So it's very common. Everybody knows about this disease, but nobody knows the options of it, when to approach the doctor, because everybody is more comfortable taking these drugs over the counter rather than coming to a doctor and getting an expert opinion. So we have seen patients who have been taking these drugs for tens of years, like decades, 2 decades, 3 decades. They have been taking, but not even one single consult. I think this topic is very important as professionals for us because there are implicated side effects of taking these drugs for very long, as well as the disease itself has its long-term effects. So it's very important to understand this disease. So thank you for bringing up this topic.
Most welcome, sir. Thank you so much. As you rightly told, it is the most common problem, and people are very much used to take the common drug over the counter, and they are taking it in the morning without having any food, and they're taking it as a granted kind of problem. But as you rightly told, it has its own long-term effects. So, on this particular point of view, I wanted to know, like, what exactly is GERD and how it is different from simple acidity or heartburn.
So acidity is the common term that we use when you have a burning sensation in the center of the abdomen, uh, up on the upper side, just below your chest cage. When you have burning and when it is in the center, we usually call it as a gastritis or a burning sensation. So this is because of the excess acid secretion that is released inside the stomach. Sometimes this acid reflects back into the chest, or even some food material in hypersensitive people. If food material reflexes back into the chest, into the esophagus, I would rather say, that will cause a burning sensation. This can be because of hypersensitivity of the esophagus, or it can be because of the acid that is secreted in the stomach, which is reflexing back into the esophagus. That is the food pipe. So this is basically a symptom of gastritis. Whereas GERD is basically gastroesophageal reflux disease. So a little bit of reflux is common for everyone after having their stomach full. That is very, very common. So we don't consider this as a GERD. So it is just an acid reflux which will subside on its own. We don't have to take any kind of medicine. But when this problem becomes so much that they have to take medication, otherwise every time they take food, the food comes into their throat, into their nose, into their mouth. So this is going to cause a lot of problems. When this happens, whether it is acid or just the bland food that we eat, or sometimes even the bile that is secreted into the duodenum, that is first part of the small intestine, back into the esophagus, then we consider this as GERD, gastroesophageal reflux disease. It happens on a regular basis, at least 3 times in a day, 3 times in a week. We consider this as a GERD problem. We consider it as a disease as such.
Yes, sir. So, why do you think this GERD is becoming so common in today's generation?
Um, for a lot of reasons. Uh, but the most common cause, even for treatment, what we say is we have to change the lifestyle. So the most common cause is lifestyle itself. Um, Take for example, like we are now used to taking a lot of fast food, which is like fat. Most of it is fat, basically cheese, all this stuff, and a lot of oils we use, adulterated oils, all the things which are very difficult to digest. When you take adulterated food or fast food, which is like high calorie density, because the lesser the calories, it's easy for the stomach to digest, for the body to digest, the intestines to digest. The more calorie diet you take, it's very difficult for it. And fat is not something that is very easy to digest, as you know. And second thing is we are now food is so easily available these days. It's available everywhere. Even it has become such a habit that people, when they get bored, when they just meet someone, or when they do something, they just want to eat. It's not like a need kind of thing. They don't wait for that hunger to build inside your body. Food is so easily available. You just grab something, you keep on eating. So it has become a lifestyle habit. Eating itself has become a lifestyle habit. So it's not like a need now, it's rather than a habit. So this has changed a lot. When you don't give rest to your stomach, you don't digest it properly, this food is going to pile up in your stomach and it's going to reflux back because you are eating in excess. Third problem is like you don't have a proper lifestyle, you don't eat on time. I mean, it's not necessary that you have to eat at this particular hour, like breakfast, lunch, and dinner. Your body itself has a circadian rhythm. It will tell you when you are hungry. You are supposed to eat when you are hungry. But most of the people, if you see, people keep on saying that you have to eat on time, otherwise you will get gastritis. So it's nothing like that. So when your body is saying you are hungry, you take food. And that too, again, the quantity of food is again very, very important. As I've told, quality is very important. Now the quantity is important. So because excess food is available, we have a tendency to eat a lot of food. For example, if you see in the South Indian custom, we have a plate full of meal. So we have like three, four different kinds of curries, and then we have curd. So you are eating quite a lot of quantity. But where is the physical activity for that? We don't have a physical activity. Most 90% of us are now at desk job. We are not doing that hardcore work. Even the farmers, if you look at like earlier, it used to be different, like the way they used to work, the kind of food they have. But now even the farmers, they are not like doing that much of physical work because a lot of mechanization happened within the agriculture itself. So all these things are building up. So when you don't have adequate physical activity and then you eat a lot of food, this food is going to come back because stomach has to digest and push it forward. When it cannot push forward, it will push backward. So anything that goes in the opposite direction is a disease. Okay. We have a lot of checkpoints. In the throat, we have a upper esophageal sphincter. That is first checkpoint. Second point is like esophageal gastric sphincter. Third checkpoint is the duodenum at the pylorus. And like that, we have checkpoints at different levels so that food is moved only in one direction. When it's coming in an opposite direction, that is when we call it a disease. This is the reason. These are some of the reasons. And stress itself will increase your acid secretion. Most of the people have the habit of eating while they're watching TV or a movie or phone, so they don't have any concentration on the food that they are eating. And there is a strong connection between your brain and the digestion. So brain will get its signals from his nose, eyes, and mouth. So you are using all your senses towards a phone or in conversation or towards the TV, and you are not adequately stimulating your brain, which does 20% of your digestive process. Because when the brain gets stimulated, it releases 20% of the intestinal juices that help in digestion. So you are blocking that. So these are the reasons. These are some of the very important reasons that we are seeing these days. So we have many other reasons like this.
Yes. So, what are the early warning signs and symptoms should find themselves that they have GERD? So, what kind of symptoms they will get?
Yeah, initially it starts like people have a tendency to eat a lot of food, so it starts like burping right after taking food, bloating sensation, little bit of burning if they develop H. pylori infection and gastritis. But slowly, as it goes off, as they put on weight or as the things go on like this, the number of burps will increase. The more number of burps increase, as the frequency of the reflux increases. As I said earlier, reflux after food once or twice is fine, but if it becomes like routine, then it becomes a disease. So as the number of refluxes increases, it will turn into GERD. So this is how it gradually develops. At a certain point, when the GERD is like very, very prominent, some of these patients will develop pulmonary symptoms also, respiratory symptoms like asthma, because the acid that is refluxed or the food that refluxes back into the mouth will trickle down into your lungs. So that will cause asthma problems. Then people will have that recurrent sinusitis because it is coming back into the nose, and your tooth will get decayed very fast because the acid is refluxing back into the mouth. So decayed teeth will be there. Then you have a bad smell coming out of your mouth because that halitosis we call. So because of the reflux. So all these things will keep on developing. So if you find any of these things like recurrent sinusitis, decaying teeth, or a halitosis, or asthma, or difficulty in breathing when they're lying down, immediately food is coming back into their mouth. All these things are like advanced stages of GERD, we can say.
Okay. So, how do you diagnose this GERD, sir? Like, which tests are most useful for diagnosing this problem?
So the first thing is always history. Patient will give a lot of hints that he is having a GERD.
Hmm.
So, and the second most important test that we do is an upper GI endoscopy. So initially, when patients are less than 30 and all, we try to give some medicines and try to adjust their lifestyle and eating habits. But if they don't work and the patient symptoms increase continuously, then we suggest these patients to undergo upper GI endoscopy. Upper GI endoscopy is advised because we will be able to see the damage GERD has caused to the lower esophageal sphincter, that is the sphincter between your food pipe and your stomach. That is a valve-like thing. So we get to see like how much it is damaged. So based upon the damage, can suggest the patient whether they have to change their lifestyle, their diet, or whether they have to take medicines on a longer term, or they have to go for any endoscopic or surgical interventional procedures. So this will help us in doing that. So once that is done, and once we have an idea that there is a structural damage to the lower esophageal sphincter, then we have to see in some patients like who are planned for a procedure, like a surgical procedure. When they're planned for a surgical procedure, then we do two additional steps usually. There is a doubtful diagnosis whether the symptoms that are related to the lungs are because of reflux disease or not. So these patients, we advise them something called a pH impedance study. So this will tell us what kind of reflux is happening, whether it is an acid reflux or a bland reflux or an alkali reflux that is going into the lungs. So, and it also will tell us like how far that reflux rate is coming into the mouth, like whether it is coming up to the mid chest or up to the throat or back into the mouth. So this will give us the level as well as the kind of reflux rate that the patient is having. The second test, which we call a high resolution manometry, will tell us like how the esophagus is functioning, because that reflux problem is something similar to a regurgitation. Regurgitation or eclasia also, we call another disease called eclasia, where food is stuck in your food pipe. It will cause similar symptoms like reflux disease. So to differentiate that thing, we ask for a test called manometry, which will tell whether the esophagus is having that peristaltic function. Peristalsis means it has to move forward. The muscles will contract in such a way that the food is moved forward. Whether that function is working or not, we will know based upon the manometry test. So this test we will ask when we are planning the patient for any interventional procedure. We don't ask this test when we are advising medical treatment. We ask this only when we are planning an intervention procedure, either endoscopically or surgically. So these are the three basic tests, and the history is the most important that will give us a hint.
Okay, sir. So, can this problem which we are talking about, that is GERD, will lead to heart diseases like, uh, or else will it be calm, or in the sense we, for example, have this problem from last 10 years, will it mold to the other way, or will it be remaining as the same?
It won't cause a heart symptom, but it will mimic a heart problem.
Mhm.
So in emergency rooms that we used to see, at least 50% of the patients will come to emergency in the middle of the night thinking that they have got a heart attack. Okay.
Okay.
But we do ECG and when we do an echo and some blood tests, we will come to know that it is not a heart disease, but it is basically a simple reflux disease. So,
Mm.
so you see the kind of overlap of symptoms that we have between a heart disease patient and a GERD patient. So it's very difficult to tell whether the patient is suffering from a GERD disease or a heart disease or even a simple gallbladder cholecystitis.
Mm.
This is also very difficult to say. So all these three diseases will have something similar symptoms. So what we first do is we give a pantoprazole injection. By the time he gets some kind of relief, uh, we will do ECG, echo, and other blood tests, and probably we can give the patient some aspirin so that we will know what is happening. At least he will get symptomatic relief. So it won't cause a heart disease, but it will mimic a heart disease. This is
Weak.
very to know. That doesn't mean that 50% chances are there, though I'll take a pantoprazole. No, it doesn't work out like that. So if it is really a heart attack, then you are going to lose life. So you cannot take chance like that. If you are having very severe symptoms in the middle of the night or any part of the day, it's better to go to an emergency, get a gastroenterologist or a gastrosurgeon's opinion, and proceed further. And second question that you have asked is whether it will stay like that or it will transform into any other. Yes, GERD has a tendency because acid is not a natural environment for the food pipe, or for that matter, food or any bile. It's not supposed to stay in the food pipe for long term.
Mhm.
So when it is getting exposed to foreign material repeatedly,
Mhm.
there is a tendency for the cells in the food pipe to change into a precancerous or cancerous cells. Precancerous are before cancer cells, and they'll will turn eventually into cancer cells. This happens in almost like 16 to 70%, 17%. So earlier, food pipe cancers are more common, used to be common in the throat level up to the mid chest level. So it is a different kind of variety. It's called a squamous cell carcinoma. It used to be very, very common when I was in training, but now it's not, it's the other way, because the acid gets exposed to the lower esophagus most of the times. We are now seeing most of the esophageal cancers in the lower third, that is just above the upper abdomen. So in this area, it has become very, very common. These are adenocarcinomas. So adenocarcinomas and squamous cell carcinomas are completely different. The way they present, their etiology is different. The risk factors are different. So adenocarcinoma, if patient is getting adenocarcinoma of the esophagus, most of the time, 70% of the times, it's because of the GERD disease. And this happens in almost 17% on a longer term. So that is the reason why it becomes very important for us to control the reflux rate rather than the symptoms. So if you go to a medical gastroenterologist, his way of thinking is different. If you come to a surgical gastroenterologist, his way of thinking is different because of this matter. Because as a medical gastroenterologist, most of the medical gastroenterologists, they'll advise medications which will decrease the symptoms. But when this problem is very significant, it's sometimes it's very wise to undergo surgery, which will decrease the reflux as such, rather than symptoms. So these surgeries are successful in almost like 80 to 85% of the patients in controlling the reflux. So the remaining 15% of these patients, they can be managed with minimal dose of medications. They don't need like continuous treatment with pantoprazole or omeprazole. We can decrease the dosage. They can take it on need basis also. So this is one problem that we have to take very seriously. Other problems are esophagus will develop ulcers, which will start
Mhm.
bleeding. Then again, these ulcers will form strictures once we start treating them. So that is stricture is basically narrowing of the food pipe. So they'll find it very difficult to swallow when they develop that strictures. They find it very difficult to swallow. Even they develop carcinoma, also they'll find it very difficult to swallow because of this reason, because it's blocking the path. And in longer terms, when patients have this extraesophageal, that is the lung symptoms, in long term, these lungs will get damaged significantly, which will lead to something called ILD, that is interstitial lung disease. These interstitial lung diseases, there is no other option because they won't be able to manage all these saturations and all. So it becomes very difficult for them.
I wanted to know, like, as you told, this pantoprazole and domostol and Dizin syrup, there are some products available in the market. People are using it. So there are some people who are using it from their early 40s, early 30s. So will this cause any side effects, sir, like when we use it for a long time?
All the medicines will have certain side effects because these are all chemicals. That is the first thing that we have to understand. And when you take these medicines, which are acid suppressants on the longer term, because of the low acidity level, the intestinal bacteria will change. The good bacteria will be replaced by bad bacteria. So these patients will tend to develop IBS and IBD more frequently compared to the regular patients who doesn't need these medications. The second thing is with the Digene and other antacids we call. So because these antacids have strong salts in those, aluminum and magnesium, phosphate, all these things. So these will cause bone disruption. So there will be changes in the magnesium level, and some of these will cause constipation. Some of these drugs will cause diarrhea. So all these things problems are there. And when you suppress the acid in the longer term, uh, there will be a decrease in calcium absorption, which will cause bone osteomalacia, we call, because bone will become weaker. Bones will become weaker. So we don't advise any of these patients to take medicines for longer term. More than 30 days, we don't advise anybody to take. So we have to give a break, and then you have to replace again calcium, all these trace elements before starting another course. So all these issues are there, and there are certain studies which have and shown, or as we can notice in our regular practice, we have noticed that there are certain kind of tumors which will increase with this acid suppression. Not the esophagus tumors. It's something in the duodenum. We call them neuroendocrine tumors. So there is an increased incidence of neuroendocrine tumors after the introduction of pantoprazole, omeprazole, all those things. So you cannot take these drugs on a longer term. It's not safe.
So there is one issue. For example, elderly people, they fall. Generally, they have the issue of falling down. And let us say one person falls down and is taking medication like getting the pain reduced in terms of combiflam or brufen or something like that. So as we know, like these medicines have impact on our GERD issues. Say, for example, that patient is suffering from GERD and is not moving, always sleeping, and this reflux is coming up. So, what kind of care these people should take, sir? Especially elderly people who have the falling issue.
Yeah. So most of the elderly patients, they have arthritis issues. They have bone pains because of degenerative arthritis, all those things. So these patients are usually prescribed painkillers which belong to a class called NSAIDs. So these NSAIDs have very bad influence on the stomach, which will increase the ulcer rate in the stomach, causing more acid production. So patients who are suffering with GERD already, they should not take NSAIDs. It's not a good idea. And those patients who are developing GERD because of NSAIDs, they should go for alternative medications. So there is no other way. And nowadays we have a lot of alternative options, even the opioids, which are very strong painkillers. Now we have uh, less addictive opioids available in the market. We can choose those things, and we have patches which are useful for 1 week continuously, which can be used for 1 week continuously. Those patches are available, so we can always shift to those drugs. So again, it's understanding between the physician or the orthopedician who prescribes these NSAIDs. They have to understand the patient, ask for particular symptoms, and change them according to that.
So, sir, what lifestyle changes should one person should make so that they will not fall in this GERD kind of issue?
The main thing is what you are eating, how you are eating, how much you are eating, when you are eating, why you are eating. So why is also important. What you are eating, like you should avoid high fatty food, eat something that is easy to digest. Okay, that is the most common thing. How you are eating is more important. You can't eat your stomach full. As our elders used to say, you should always have some amount of space before you stop eating. So you should always go half empty stomach or half full, you can say. That is the best way of eating, and you cannot combine solid food with liquid. Both the digestive rates are different. So try to eat solid food as much as possible. Have very little bit of water or any liquids just to gulp it. When you find it difficult, you can gulp it. You can have as much as you want after half an hour or 1 hour, whenever you are comfortable. So that is very important. Then when you are eating, so you don't need a timetable, a fixed timetable to eat. Your body will tell when you are hungry, you eat that much. You don't have to eat anything extra or anything less than that. So, but when you are eating, again, it's the quality and how you are eating. Then quantity is important. Like you cannot eat how much ever you want to eat, as I said. Then where you are eating. It's very important to understand that food has a lot of philosophy in Indian culture. Um, we call something called Swayam Pakam, which is like you have to eat what you are making or your family members will make. You cannot go to a restaurant and expect the most hygienic food. It's impossible because they are doing a business, so they will find all the ways to save their money. So this is something that you should avoid. And why you are eating. So whether you are eating to live or living to eat, that is one question everyone should ask. So when you restrict yourself with these 5 questions, I think most of the things will change. And again, lifestyle is very important. Most of the people that I keep seeing, particularly the IT guys, because there there are plenty in Hyderabad basically. So you see IT guys everywhere. So they are in a rat race all the time. They keep on. They're all always on their feet. So you should know what is your purpose. So you should understand like how much is okay, what is enough. Enough is
Yes.
enough. That question should come to everyone. So that will define how you are going to live, whether you're going to live healthily or wealthily, or whatever purpose you have. That is the question that will put a full stop to that. Enough. That everyone should ask.
Sir, in this context, which food habits will worsen the GERD? Like once the person is affected with GERD, so what kind of food habits will worsen it?
Very high fatty food will increase.
Hmm.
Spicy food will increase. Spicy food increases it not because it has more capsaicin or other tangy thing. It increases because it slows down the motility. Okay, spiciness is not because of the spicy food. The acid doesn't get secreted more because it slows down the motility. It increases the acidity, and taking too much of sour food also will increase the acidity. And better to avoid coffee, tea, too much of coffee, tea, and then pop drinks. Too much of sodas is not advised. Alcohol is absolute no no. Cigarette is absolutely no no. Cigarette and alcohol, if you take, it is going to increase your GERD symptoms. And not only that, cigarette and alcohol both are themselves risk factors for food pipe cancers and stomach cancers. So they are going to just add fuel to already existing GERD problem. So we should avoid taking alcohol and stop smoking.
Okay, sir. So here I wanted to know like what medical treatments are available as of now to deal with this issue and how effective they are for long-term solution for this
So
problem.
yeah, we have a lot of medications that are available, and most of them are over the counter. I think almost 100% of them are over the counter in India. That is something that we all have to look at. We have a first class called antacids. So everyone knows Digene and other similar drugs, which are like all that stuff. They are all basically salts which will neutralize your acid in the stomach. The second thing is H2 antagonists, which is like ranitidine or famotidine, which are like very low effective anti-secreting drugs. So they decrease acid secretion by 50 to 60%, maybe not more than that. So in mild gastritis, these drugs should be fine. So most of them are withdrawn now because they are replaced by something called proton pump inhibitors. So these are the common things that we see now, um, like pantoprazole, omeprazole, rabeprazole, lansoprazole, all these drugs. So they all act by decreasing the acid secretion almost by 90%.
Oh,
These drugs differ by the length of their action, whether they are working for 12 hours or 24 hours or 22 hours. Based on that, they differ. And we have newer drugs which are called voniprazoles, which are voniprazole like that. So, which will also decrease the acid production. So, there are a lot of drugs available, and these can be safely taken for a reasonably good time. I can't say long term, but they can be taken reasonably good time because you have to allow your body to heal also. So probably 60 days is fine, but more than 60 days, I think it's not worth taking this medication. See, it's very simple. You are not born to take medications.
yes.
If you are taking medications, there is something wrong. There is something
Yes.
wrong means you need to see a doctor. It's not like you go to a pharmacist or you go to a roadside pharma shop and take this medication. That is not the right way to do. Our goal as doctors is to get these patients out of medications. So what is the best thing to do for them is should be assessed properly and should be advised properly. So my philosophy is very simple. I write as less medications as possible because I want my patients off medications. All these medications are chemicals. We need to understand that point.
Yes, sir. So, is the surgery option for GERD, sir? Like in as you already told about surgery, so is it good to go for surgery?
It's very good. It's very safe procedure, but it's technically demanding procedure. It's very, very safe. So the only side effect probably is they'll get some amount of all the patients, almost all the patients will have some amount of discomfort while they're swallowing because all these days the sphincter is very loose. Suddenly we try to tighten it a little bit. We try to readjust it to its normal size. So it becomes very new for them. So they all these patients will feel some discomfort for a few months. Some will feel discomfort for a week, some will feel discomfort for three months, some 6 months. So it depends again on the personality because GERD disease itself is very common in type A personalities. Type A personalities are basically anxious and a bit of paranoid, and they evaluate themselves quite a lot. So these patients tend to get these kind of functional diseases, we say. So surgery is very, very safe. It's done laparoscopically. So when it's done laparoscopically, this can be done in a daycare procedure. That means you can get the surgery done in the morning and you can get discharged by evening. So this is that safe. Of course, most of the doctors they're comfortable keeping the patient for 3 days or 4 days or whatever it is. But in our unit, in my care, my surgeries, I prefer doing the surgery in the morning. I want to discharge them by night, unless until patient asks for an extra stay. And most of the insurances they compel us to keep the patient inside the hospital for 1 day. So it's absolutely acceptable, but they should be back to work within 2 to 3 days. So yeah, not much pain, very comfortable. Only thing is they'll take some time to get adjusted to the new mechanisms. So what we are doing in this procedure is we are trying to repair the loose sphincter that they have a little bit, tightening it so that the food won't reflux back into the food pipe. So that is what we are going to do. It's a very, very, very safe procedure. Nothing to worry about.
Okay, sir. There are some people who don't even know that they have GERD. So, if they leave it untreated, what kind of problems will it arise, sir?
So as I've told, they can develop ulcers in the food pipe, then strictures in the food pipe, then slowly they can turn into cancers in the long term, and they might develop chronic respiratory problems like bronchial asthma. And most of these people they are treated for asthma. They're not asked the right questions because again, like uh, it's like saying you don't ask what you don't have in the brain. So when they go to pulmonologists are not expert in GERD. So most of them they miss that part. Uh, if patient is lucky, they'll go to a pulmonologist who is like an expert and who understands different processes also. Those kind of people, they're a bit lucky to get those things. And you will have a chronic sinusitis problem. Then you have dental erosions. Once you have dental erosions and you get treated for these teeth problems, again chewing is difficult. When chewing becomes difficult, again you don't digest food. Again that will increase your reflux problem. So dental hygiene is also very, very, very important to avoid GERD.
So, finally, what advice you want to give to all the patients who are suffering with this problem so that they can happily manage this problem in a long term manner, leading their lifestyle in the best possible manner?
It's very simple. Don't experiment. I understand everybody will have some amount of gastritis once in a while because of the lifestyle that we are all leading nowadays, including me, including you, Dr. Rajesh. Nobody can escape that. Once in a while, it's fine. But symptoms are going bad. Like patient is losing weight. He's finding it difficult to swallow. He's suddenly the reflux disappears and weight loss, and he's losing that appetite. All these are negative symptoms. When patient is developing these things, I think it's high time that they should go to doctor at any cost. Fear is not going to solve anybody's problems. You have to take that bold step, go to a doctor, get it checked, and have a proper treatment. So Second thing that I would advise is stop taking medications without a proper advice. So over-the-counter drugs, just because they are available, it's not right. You can take them for a day or two, but if symptoms doesn't subside, I think it's time to go and see a doctor. And yes, it costs a bit when you come to a doctor, but it costs a life when you don't go to a doctor. That is also important.
Thank you so much, sir, for sparing your valuable time and giving us a lot of information on this most common problem. As you already told, nowadays it is a very common problem for all the people. And this particular podcast, if they listen, definitely it will improve their problem if they are already facing it. And those who don't have this problem, definitely they will change their mindset and will have a healthy lifestyle. Thank you so much, Dr. Pavan, sir, for giving your valuable time.
Thank you. Thank you. Thank you.